Hello, I'm Dr. Frawley. I'd like to share with you my insights about today's reported findings visit. I've personally met with almost 8,000 patients and have taken care of about 4,500 patients that have qualified since 1995. In my experience, the biggest mistake patients make that have qualified is not making the commitment to start care. This is a bad decision that many patients look back on and regret. Many of them rapidly decline. If your case has not qualified, I might refer you out. If your case has qualified, the idea that you need time to think about it is a mistake. Your health is always moving in a positive or a negative direction. You cannot wait when it's surely moving in the wrong direction. A few quotes on commitment that are insightful. Grant Cardone says, "Commit first and figure the rest out later." Marshall Silver says, "Fall forward fast." He means commit to something, make a decision to move forward fast. If it's the wrong decision, you'll know only after you commit. If it's the wrong decision, you simply make a new decision. Our plans are non-invasive and effective and may answer your prayers. It's been my experience that when a patient has fear, uncertainty, and doubt, this is what drives their indecision. They may well be thinking, who is this chiropractor that says he can help? Why is no other doctor doing this? Why isn't my medical doctor doing this? Is this some snake oil, or is this real sound science and a new approach I desperately need? This all bounces around in people's minds. My neurobiomedicine model has been refined for over 22 years, and it's based on the most accurate science of physiology, how things work. We just remove what you don't need and provide what you do need. Through proper testing, a proper root functional cause diagnosis, which gears are off, and then we design a custom proper treatment plan. Your body's innate intelligence then heals itself. This is quite profoundly simple and highly successful. The neurobiomedicine approach is cutting edge and new, but our videos on the website and in office, our few hundred testimonials, our professionalism, our vast knowledge on health, our awesome customer service should reinforce that you're in the right place. I have the largest practice of its kind in New Jersey. We are ranked #1 in many categories. We do not guarantee results, but we expect results for you. Our results for 2015 and 16 are as follows. If you've qualified, and only 50% of the cases qualify, positive improvements are seen in 1 to 3 weeks in almost 90% of the cases for the top 10 symptoms. Better energy, better sleep, better focus, moods, memory. My cycle and hormones are better. That's male and female hormones. Pain, balance, and movement. I can move easier. I'm not having stopping, starting problems. Less stiffness. My digestion is better. Swelling is less. I've lost weight. There's been positive hair changes, and I've improved libido. We also get a 5-star rating, over 97% on our customer service. So, these results should give you comfort and strengthen your resolve to make a rational commitment to move forward today. Our plans have a 20% prepayment discount that is good for today only. If you are a major skeptic, you should not start care. I don't want to be involved with major skeptics. If you question your commitment to do your part, you should not start care. Otherwise, you should commit today and move forward. If you've qualified, we'd rather know today, because our office has a limited 12 new spots per month, and another patient can fill your spot. If you need time to organize monies, or you need to write a post-dated check, we can accommodate that. You would be required to put a down payment, and then the balance of the prepayment discount can be paid within 1 week from today to receive the 20% prepayment discount rate. You've been suffering, being bounced around from doctor to doctor. You're not being heard or listened to, and you may be declining rapidly. Give yourself a chance and commit to getting healthy. You can come back in the future and see if you requalify, but if it's after 30 days, all tests, all paperwork needs to be redone, and the cost for the new examination, the $199, would be due again. Please watch the next 2 short videos about our neurological testing. These tests will be reviewed in detail and will determine whether or not you require brain-based care. You're going to watch one video on the NSI, and another video on the ANS testing. Both of those measure this right here, which is the gear called your master nervous system. I look forward to chatting with you soon. Thanks. Hi, this is Dr. Farley. This is to explain to you about our examination process. And after we meet for the consultation and we look over your information, we will make a decision whether we should together move forward to go on to step 2, which is a full examination so that we can determine whether your case would qualify or not. So what I'm going over with you is what that examination possibly will be if we're moving on to step 2. The first thing that we're going to be going over with you is that there's the 3 gears, and in those 3 gears, one of the gears is the nervous system. That is the master system of the body, and it is also the system that transduces the energy from the earth, called geomagnetic or Schumann frequencies. So when we look at physics and how things work and how it's impacting our health, the nervous system is the link to allowing our 8 subsystems to work properly and allowing us to get proper energy so that things can work. In the report that you will get when it's all said and done, it's going to have everything explained to you. It's going to have all the functional neurology explained to you. It's going to have all your findings explained to you. It will probably be the most thorough exam you've ever gotten, by far. I hear this over and over and over again. So the first thing that you're going to see when you come in, you're going to be sitting on a table right here, and you're going to have your shoes and your socks off. We're going to test your peripheral nerves. We're going to test the nerves in your hands and your feet. The nerves carry the information from the brain down to the body back to the brain. If you show nerve damage, we'll be able to tell you how much, how bad. We'll also be able to correlate that, because you may be having arrhythmia, gastrointestinal problems, hormonal problems, other issues that could be connected to the nerves not working well. We also will then be using our scanner here, and this is what we call the interactive brain-based testing machine. There's only 2 of these in the state of New Jersey. And there's 7 different tests that we're going to run on here. These 7 tests combined, along with the peripheral nerve exam, the cerebellar testing, and the diagnostic neuromuscular scan, we're getting as close to 100% possible as we can to look at that nervous system and say, hey, how is this working? The 7 tests that will be run on here are extremely important at letting us know how this overall brain is working. There's the eye-hand program, the tracking program, saccades, tachistoscope, metronome, optokinetics, and visual motor. So after we're all done with this, we're going to put this together in a report form. We're also going to, as we measure the cerebellum, have that in the report here, and the neuromuscular scan, all in the report here. So when we're all said and done, we can say with certainty, this is the current level of where your nervous system is working. We also will be able to tell you how much damage there is in the nervous system. We'll be able to tell you what level of function are you at. Are you at optimal brain function? Or do you have mild deficit, moderate deficit, severe deficit, extremely severe deficit, or profound deficit? It'll also let us know what your risk is of other potential neurodegenerative diseases, because if the nervous system is breaking down, your risk for those goes way up. Also, what you want to know is if the nervous system function goes down, your entire health goes down. So when we run through these different tests with you, give it a second, please. We're going to be plugging in all the information. We'll be plugging in your name, and we're going to take you through all of these different scans and tests. As we do that over a time frame, As we do that over a time frame, we'll be able to document where you are. Each test takes usually about a minute, minute and a half. This entire process in here will take about 30 minutes. From there, you'll be leaving, and this visit, the second visit, if you have a spouse, it is highly recommended that they should be here with you. They need to see the test that we did. They need to see how thorough this process was, so that they can then understand what it is that we're talking about. So on your step 2 examination, your spouse should be with you, and it's highly recommended. On your step 3, it's mandatory that your spouse comes with you for 2 reasons. I want to make sure that we're sitting down the three of us, and talking about what we found is wrong, make sure that we're all in agreement, that it makes good sense, and then also, what are your options if you've qualified? What are your options? What plan makes the most sense for you? What can you afford to do? What can you not afford to do? So you're going to see my staff. They're going to be scheduling you and encouraging you. Bring your husband or your wife with you for the step 2 examination. And it's mandatory to bring them with you for the step 3, which is the report of findings. The report of findings will be whether you'll find out whether you've qualified or not. We'll go over your exam findings and we'll let you know what we're proposing to do. And if you didn't qualify, we might have some options for you and a referral for you. So thank you. I hope this was helpful. We'll be meeting in a few minutes and we'll go over your case in detail. Thanks. Hi, this is Dr. Farley. I'm going to be going over with you our new autonomic nervous system testing. This is not used to diagnose any disease. It's mainly used to measure physiology. When I talk about those gears and we talk about the master nervous system, that gear, we're breaking the master nervous system down now into the other comprehensive NSI testing that you just saw. And then we're going to be going over now what this piece of equipment does. It's new to our office. There's only one of these in the state of New Jersey. The piece of equipment is very painless. You sit down. We put these little clips on your wrists, both sides, and you literally sit in a kind of a dimmed room, quiet, not moving around, not blinking your eyes, and we take a measurement. The purpose of this is because the autonomic nervous system, 90% of the output of the brain goes to the autonomic nervous system. So that autonomic nervous system runs your heart, your liver, your lungs, your kidneys, your gastrointestinal system, your immune system, your skin. It runs all your hormones, thyroid hormones, adrenal hormones, sex hormones. And it also mainly has a lot to do with your stress response. So what we're actually measuring is on here what's called heart rate variability. And the traditional measurement tools for heart rate variability were used mainly to look at the heart. And then they realized over time there's dramatic impact that we can see on what's going on with the rest of the body by looking at this. So the space in between your heartbeat, boom, 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 should be varied. That's why it's called heart rate variability. If that space is not varied, and the computer documents exactly what it is, then it means it's a sign that your body's not healthy and your autonomic nervous system is not doing well, and that you're at risk for acute and other chronic health problems. So when we do this test, you're going to get a report. It's got 21 measurements in there. The science on this, just go over this with you for a second because it's really important. I don't buy anything that doesn't have science to back up the validity of the testing. But the science of this, I believe at this point in time there's 10 or 11,000 scientific studies published on PubMed on this. And the full body analysis with heart rate variability was initiated by the Russian Navy in 1968, and the objective assessment of the human body using heart rate rhythms became fractional neurodynamics, and completed in 1983 with the work of Dr. Bevsky and Dr. Smirnov, like the vodka. Dr. Smirnov and Dr. Karamov worked together to develop the current technology, and then Dr. Kessler now jumped on board. And mainly, it's really unbelievable information. So we're going to be able to get a bunch of real detailed information on you. We're going to be able to look at your parasympathetic nervous system, your sympathetic nervous system, your neurohormonal control, which is the brain that runs all your hormones. That's the brain thyroid axis, the brain adrenal axis, the brain gut, the brain blood sugar, all those things. And then what we can do with this is we can jump in and periodically take a measurement to say, okay, so where were you and where are you? It also tells us about your biological age versus your chronological age. So you might be 57 and your biological age might show that you're 67, or vice versa. We get very simple, we'll give you a very simple report, and from here also I can give you suggestions for nutritional support or other things that we're doing here in the office to help improve this. And this is a great way over time to look at what your overall health is. It also looks at your, if I didn't tell you, you're going to get a stress index. It's going to tell you how good or bad the stress response is. We're going to get an idea of the autonomic nervous system strength. We're going to get an idea of your SDNN. The SDNN is a measurement that's now being used to track cancer patients. And if the number is high, it means there's going to be a good outcome. If the number is low, it means there's not going to be a good outcome. There's also other research now that the autonomic nervous system is more important for tracking a cancer patient to determine what the outcome is going to be than the actual even size of the tumor. So this is really important stuff. You're going to look at, again, the brain endocrine axis. We're going to look at your metabolic energy resources, which means if you exert yourself doing work, mentally or physically, how quickly are you to bounce back? We're also going to look at your psycho-emotional state index. I mean, it's a picture of your overall brain function. We're going to look at brain toxicity levels. We're going to look at intracranial pressure. We're going to look at your BNT, which is your brain neurotransmitters. Are they in balance or are they out of balance? We're going to be able to look at your spectrum of brainwave activity, all the different brain waves, delta, theta, alpha, beta, and high beta, which is called gamma. We're going to be looking at your level of biorhythm coherence. This basically has a major influence on looking at where your body's going. Are you cycling in the right direction or cycling in the wrong direction? We can use this with another one of the tests called your comprehensive peak performance to give you an idea whether you're going to be improving, you're moving in the wrong direction, getting worse, or you're stable. Again, we talked about your biological age versus your chronological age. It also tells us about your mineral status. It tells us about overall inflammation inside your body. It tells us about your cortisol, which is your stress hormone. It tells us about your DHEA, which is your sex hormone. It tells us about pregnenolone, which is the precursor to the stress and the sex hormones. It tells us about your estradiol levels. It tells us about your insulin levels, which can tell us a lot about your ability to regulate blood sugar. It tells us about your thyroid, T4 to T3 conversion. It also tells us about your TFI, which is your thyroid functional index. So we can get a tremendous amount of research from this piece of equipment. It's new. It's now incorporated into all new patients and even existing patients. So we have another way of tracking you and determining whether you're moving in a good direction or bad direction. The test will take 7 or 8 minutes, but the information is invaluable at me figuring out which of the gears are off and then setting up, giving you a proper diagnosis to give you a proper treatment. Thank you. Okay, this is our whole body vibration unit. The purpose of this is to help the brain activate, which means turn on. We do various different treatments while you're on here. We hit the button, the plate vibrates, and the purpose of that is to send new information to the brain and to help heal the nerves, many times in the feet and the legs. This has a dramatic impact on top of everything else that we do to help the brain and nerves work better and also get muscle strength. Thank you. Hi, this is Dr. Farley. We're going to be going over another part of the brain-based treatment. Again, the purpose of this is to activate the brain, which means turn on, and allow the brain and the nerves to work better. And because the brain, again, runs everything, this is an important brain-based treatment. While you're laying on here, this is the hydro bed. It will take high-intensity water and move it up and down the body. The purpose of that is, again, is to go deep into the tissues where there's these receptors that transmit information to the brain, and again, it makes the brain activate and work better. This is sometimes a little treatment that we also include. There are little clips on your ears, so while you're laying on here, there's not much that you feel, maybe a little bit of a tingling sensation. And the purpose of this is, again, to help the brain work better and to lower the stress response. You normally lay on here anywhere from 8 to 15 minutes. Thank you. Hi, this is Dr. Farley. I'm just going to be going over with you some of the treatments that we do here for the functional neurology section. You'll be laying face down here at some point in time. It depends upon which station we start you at. But while you're laying down here, a few things will be done during this process. One of the things we'll be using is a little impulse. It's kind of like a tiny little jackhammer gun. It fires repetitively. And we use this at different spots along the body, depending upon where it needs to be done based on what I find that day. The purpose of this is to activate the brain, which means turn on and let the brain work properly. We'll usually be doing a lot of that activation on one side of the body because that will be based on your weaker side of the body that we found when we did the examination. The other thing we'll be doing is what's called a vibrocussor. This again is kind of like more a generalized approach than this, not anywhere near as specific, but what this does, it helps break up muscle adhesions, it also helps activate the brain, and it feels very good. And lastly, while you're lying here, many times we're taking this little wiggle device and we're putting it on different places. Many times we place it right here because this is the bottom of your stress response where your adrenal glands sit. This machine sends out a low acoustic sound wave, and the purpose of that is to help calm the adrenals and help the adrenal system work better, which lowers your overall stress response. Thank you. Hi, this is Dr. Farley. I want to go over the newest piece of equipment that I have in the office here called a Pulse XL Pro. It's a PMF, which stands for Pulsed Electromagnetic Frequency. Basically, there's over 10,000 scientific papers written on this piece of equipment. And there's rings that we may use, there's a mat that we may use, or even a chair, depending upon what we're trying to accomplish with you. What the machine basically does is it sends the same frequencies that we receive from the earth, called geomagnetic and Schumann frequencies. It drives these frequencies inside every cell inside your body, and it increases the cellular energetics, which means that every cell inside your body starts to raise its energy, which means the cells can work better and heal on a deeper basis. This is really a pretty cutting-edge piece of equipment. People are terming it anti-aging, and I'm going to be using this on almost every patient because there's multiple applications. We can use it on the brain to help the brain work better. We can use it on pain areas. We can use it on mood disturbances. We can use it on healing. We can use it on prostate problems. There's a wide variety of applications for this. There's a great pack of information I put together for you that's very detailed on this specifically. It's based off of quantum field theory and quantum physics from Einstein. So we're moving away from the idea of just looking at chemicals, and now we're looking at energetics inside the body. Tremendous amount of research on it, and I'm really happy that we have it in the office and excited to share this piece of equipment with you, and it may be something I'll be using on you. Thank you. Hi, this is Dr. Farley. I want to be going over with you our latest piece of equipment. It's a robotic laser, high intensity, high powered laser. Lasers there's over 3,000 studies on lasers, and they've been performed over the last 30 years. And they were FDA cleared in 2002. I got my first laser in 2002, right after they were cleared. And they're being used by a variety of medical specialties, chronic cases, optimization. A lot of sports teams are using them, the Dallas Cowboys, the Cleveland Cavaliers. This laser penetrates anywhere from about 1 inch to 2 inches. It mainly does a bunch of different things at the same time. So as you see, this would be there, and the laser would be aimed at a certain part of the body that we want to work with. So what does a laser do? This one specifically removes toxins, lowers histamine, and balances cytokines, which means it lowers sustained inflammation. They allow oxygen into the cells. Better oxygen means everything can work better, specifically the brain. It can help with pain. It also increases ATP production and cell growth to regenerate, increases blood flow to certain areas. In a nutshell, what the lasers actually do is they stimulate the mitochondria, which is the powerhouse of the cell, so that the cell can start the body's own healing process. And these effects are cumulative. So one visit builds on the next, builds on the next, builds on the next, and gradually over a time frame, usually between 12 and 30 visits, we use this laser to help the tissues heal themselves and to optimize function. So you may be getting this piece of equipment, and if you do, I wanted you to understand what it does and how it works. Thank you.